Are American bullies prone to hip dysplasia? Hip dysplasia is a common skeletal disorder that affects many dog breeds, including American bullies. In this article, we will explore the causes, symptoms, and treatment options for hip dysplasia in American bullies. What is hip dysplasia? Hip dysplasia is a condition where the hip joint does not develop properly. It is characterized by a loose or unstable hip joint, which can lead to degeneration of the joint over time. This can cause pain, lameness, and difficulty in walking or running. Causes of hip dysplasia. Hip dysplasia has both genetic and environmental factors. In American bullies, it is believed to be primarily genetic. Breeding two American bullies with hip dysplasia increases the likelihood of their offspring inheriting this condition. However, it is important to note that environmental factors, such as excessive exercise or poor nutrition during the early stages of development, can also contribute to the development of hip dysplasia. Symptoms of hip dysplasia. The symptoms of hip dysplasia in American bullies can vary from mild to severe. Some common signs to look out for include: 1. Difficulty in getting up or lying down. 2. Stiffness or lameness in one or both hind limbs. 3. Bunny hopping gait, using both hind legs simultaneously while hopping. 4. Limping or favoring one limb. 5. Decreased range of motion in the hips. 6. Pain or discomfort when the hip joint is manipulated or touched. If you notice any of these symptoms in your American bully, it is important to consult with a veterinarian for a thorough examination and diagnosis. Diagnosing hip dysplasia. To diagnose hip dysplasia in American bullies, a veterinarian will perform a physical examination and may recommend additional diagnostic tests such as X-rays. X-rays can help evaluate the hip joint stability, check for signs of arthritis, and rule out other conditions that may be causing similar symptoms. Treatment options. Treatment options for hip dysplasia in American bullies range from conservative management to surgical interventions, depending on the severity of the condition. Conservative management. In mild cases, conservative management may be sufficient to manage the symptoms. This can include weight management, exercise modification, physical therapy, and the use of nonsteroidal anti-inflammatory drugs, NSAIDs, to alleviate pain and reduce inflammation. Surgical interventions. In more severe cases of hip dysplasia, surgery may be necessary to improve the dog's quality of life. The two most common surgical procedures for hip dysplasia are: 1. Femoral head ostectomy, FHO. This procedure involves removing the head and neck of the femur, which eliminates the bone-to-bone contact that causes pain and inflammation. After the surgery, scar tissue forms in the area, creating a false joint and reducing pain. 2. Total hip replacement, THR. In this procedure, the damaged hip joint is replaced with an artificial joint. THR is recommended for young dogs or those with severe hip dysplasia that does not respond to other treatment options. Prevention. Preventing hip dysplasia in American bullies starts with responsible breeding practices. It is crucial to select breeding pairs without a history of hip dysplasia and to screen them through hip scoring schemes. Additionally, providing proper nutrition, exercise, and regular veterinary care throughout the dog's life can help prevent or minimize the development of hip dysplasia. In conclusion, American bullies are prone to hip dysplasia, a condition that affects the proper development of the hip joint. Recognizing the signs and symptoms of hip dysplasia, seeking early veterinary diagnosis, and implementing appropriate treatment options are essential in managing this condition. By practicing responsible breeding and providing adequate care, we can help reduce the incidence of hip dysplasia in American bullies and improve their overall quality of life.